Thank you very much, Madam Deputy Speaker. I welcome this government debate on such an important topic in World Immunisation Week. I think it's just a wee bit tragic that it's been scheduled today and clashing with local government elections, and that therefore the chamber is so empty, when I'm sure there were many members who would like to have taken part. It is of particular interest to me, and I'm glad to see other members of the all-party group on vaccinations for all, of which I'm the chair. As the Secretary of State mentioned, the history of vaccines goes back long before Jenner to the Chinese Empire, and indeed it was common practice to carry out what was called variolation in the Ottoman Empire as well. And there's documentation from travellers and from the East India Company way back 100 years before Jenner. But at that time, smallpox epidemics were common, and a third of people died. These are numbers it's actually quite hard to get your head around. And of course, for the survivors, it left them very scarred and damaged. And this was the observation that Jenner followed up, that milkmaids were noticed to have beautiful skin. Now, of course, there was a fallacy thinking that they bathed in milk, hence all the Cleopatra having baths in milk, all of this imagery, but it was simply that they tended to catch cowpox, which protected them from smallpox. And of course, it's the name of cowpox that gives us the name vaccine, from the Latin for cow. Now, we have eradicated smallpox, which was declared eradicated across the world in 1980, and we're within touching distance of eradicating polio. Eradicating a disease from the world is actually an incredible achievement and could not have been done using any other tool other than vaccination. And the vaccinations for polio came in after 5 huge epidemics that were visible here in the UK between 1945 and 1960, where instead of about 500-600 young children being affected by polio a year, it went up to 5,000 or 6,000, with about 750 deaths every year. We got the Salk vaccine, which was the injectable one described by the member for North East Bedfordshire. I wasn't quite born when that one came in. I was lucky enough that I got the Sabin oral sugar cube version. And the oral one had a huge advantage of being able to vaccinate large numbers of children very quickly. And actually, because it was oral and was excreted in faeces, it actually spread it within communities. It was a very accelerated way of carrying out vaccination. In 1988, the Global Polio Eradication Initiative was established, and as was mentioned, the Rotary Club in the UK played a huge part. And at that time, there were still 35,000 cases worldwide every year. 2.5 billion children were vaccinated under that programme, and at least 10 million cases of paralysis have been prevented. Last year, there were 35 cases. They're predominantly, as we've heard, in difficult areas on the border between Afghanistan and Pakistan, where actually a friend of mine was working for UNICEF for several years. But it's very, very challenging. And the other area where we're not sure what's going on is northern Nigeria, because it's very difficult to get data. So there's always been this problem of war zones, extreme poverty, even communities that we hardly know exist. But the last case of wild polio in the UK was in 1984. And at that time, we changed back from the oral version to the injectable, because it uses a dead strain. It's not attenuated, it's not weakened, it is dead. It cannot induce polio. As was said, the UK can be proud of being the lead contributor to Gavi, the Vaccine Alliance, and also the Global Fund, and a big supporter of many of these programmes. The last 10 years, what's been called the decade of vaccines, have saved at least 20 million lives. And vaccination is the single most successful health intervention ever. People will say clean water. Now, that's a civil engineering intervention, and it does bring health. But in actual fact, if you look at the return and the lives saved, vaccination is even more successful. But the problem is uptake is falling. Now, we're lucky in Scotland. We've managed to keep the uptake of our childhood vaccinations above the World Health Organization recommended level of 95%. This is critical to create community protection for children who are very young. Babies who are only a few months old are not yet vaccinated, and those who are vulnerable for various reasons and can't be vaccinated. Unfortunately, in England, we've seen the level drop below 95% for many of the childhood vaccines. And that is because of what's described as vaccine hesitancy. As was mentioned, the UNICEF report talking about 500,000 children in the UK unvaccinated. That is a dangerously large pool of children and now young people and even middle-aged adults, perhaps, who are exposed to catching these diseases. Now, people often put that down to this anti-vax campaign, but actually Public Health England's own research suggests it's much more complicated than that. When they did a survey with parents, they found it was actually only quite a small percentage where it was a really strong anti-vaccination feeling. There were also issues of complacency, issues of access, and those we need to tackle so that we shrink this down, as well as tackling head-on the fake news that we see on social media. The complacency is simply because vaccines are a victim of their own success. People don't see the awful impact of these conditions. As was mentioned by the member for North East Bedfordshire, people think of measles as just trivial. It's like a 24-hour flu. They've forgotten what it means. Polio, people don't see many cases of polio. I remember it from my childhood. And I was lucky enough to travel to Ethiopia with results, visiting vaccination projects there. And we pulled in to get petrol. And there was a young man, about 30, with obvious flaccid paralysis from polio. And it just hit me between the eyes, thinking that we don't see that. If you saw the result of polio, you would never think of withholding that vaccine from your children. We think there's not great risks from infectious diseases, that antibiotics will treat them. But air travel is bringing the risk of pandemics, as the Secretary of State mentioned Ebola. When we had the huge outbreak a few years ago, work was begun on that vaccine, and that vaccine was able to be used in recent outbreaks and prevent it reaching the levels that we saw in Sierra Leone 5 or 6 years ago. And it's important that we realise that antibiotics are not a solution. They don't work on viruses. Your only option to prevent dangerous viruses is to use vaccines. And we have increasing antibiotic resistance. With regards to access, as was mentioned by the Shadow Secretary of State, across the world, we're patting ourselves on the back that in poorer countries, 85% of children are getting the basic vaccines. But that's stalled. That isn't climbing. It's been like that for quite a long time. And I was shocked when we did our report as the APPG into vaccination for all in the developing world, that only 7% of children in these countries are given the full WHO 11 vaccines. As global players are preparing their next strategies and their funding plans, and also we see the eradication of polio on the horizon, this is a time to step back and think about how are we going to help across the world to actually eliminate more of these diseases. We need to aim for the fully immunised child. We need to come up with strategies to deal with remote areas and war zones. Research is a critical part of this, and it's brilliant to read that in Malawi, the trial of the new malaria vaccine is beginning. Now, it's only expected to be 40% successful, so in the scale of vaccines, that's quite weak. But in a condition that is so widespread that it causes over 400,000 deaths a year, making 40% of children immune to that, along with the other manoeuvres and actions like nets and anti-mosquito treatments, will all help to bring those deaths down. But we have access issues here in the UK. A busy parent, perhaps with several children. Maybe the first baby gets all their immunisations. Maybe the second and third doesn't. And sometimes that's an issue in some of the religious communities who tend to have very large families. Because if you're having your 7th, 8th, 9th baby, you may struggle in how to actually look after the others and get the new baby to their vaccination. They need, therefore, easy access to their GP, to the nurse, or to the health visitor. And those people need to have time to answer parents' concerns. This is one of the first big decisions a parent will make about their child. And they are seeing all of this swilling anti-vaccine rhetoric on social media. And they need to be able to ask questions, to not be patronised, to not be dismissed, but to have them answered. While uptake in Scotland is high and is above the 95%, when you drill down into those figures, we too see variation in areas of deprivation and in religious and cultural communities. So we're not complacent, and Scotland is embarking on a vaccination transformation programme because to keep the rates high and indeed improve them will require concerted action. Sometimes it's policy decisions. When meningitis A, C, W and Y was introduced for 14-year-olds at school, in Scotland we did a 4-year catch-up and immunised 14 to 18-year-olds when it was introduced. In Wales they did a 2-year catch-up. But sadly in England the advice was that teenagers, young adults and university students could go and see their GP. At a recent event it was reported to me that uptake was only 40%. Because how often are teenagers at their GP? It's not a concerted way to do it. And I don't know if that was a cost decision, but there has been analysis of the cost-benefit, cost-effectiveness of vaccines, and they are so cost-effective, they justify any process that will actually raise uptake, even home visits for a busy mother trying to help her get her babies vaccinated. And then the third one is the anti-vax campaigns. As I say, PHE's surveys suggest this is a relatively small proportion, and it does seem largely to stem around the MMR vaccine for measles, mumps and rubella. This vaccine is 97% effective, but the uptake fell dramatically after Wakefield's paper in 1998. He has since been struck off the medical register. His research was completely discredited, and yet we have President Trump in America promoting this. He is being given a platform in the US again. Now, uptake has improved, but there's a whole cohort of teenagers who weren't given MMR when they were babies, and they are the ones who are particularly vulnerable. As was said, people think measles is trivial, 24-hour flu. And yet in 1980, 2.5 million people died every year from measles. That was got down to its lowest point in 2014 at 73,000. Last year, worldwide deaths were up to 110,000. And sadly, and we're only here on the 2nd of May, 112,000 young people have lost their lives to measles in the world already this year. It is literally the most contagious disease. And if there is a local outbreak, 90% of unvaccinated people will get infected. You can't avoid it. You are incredibly infectious before there's a rash. It is spread simply in the air. And in a recent outbreak in America where they tracked back to patient 0, they found out he had infected over 40 people before he even knew he had measles. Last year we saw 82,000 cases in Europe and 72 deaths. There will be a similar number of encephalitis cases, as again was mentioned by the former Secretary of State. This leaves children with brain damage. It leaves children blind and deaf. These are not minor sequelae from this disease. These are life-threatening. In England, thankfully, we have not had any recent deaths. But the cases from 2017, when there was 259, multiplied by 4 to almost 1,000 last year. In Scotland, we only had 2 cases, and it was people who'd been travelling out with the United Kingdom. That did not start an outbreak because we had 97% uptake of the vaccine. There was therefore community protection, and there was no opportunity for it to spread. This community protection is critical. I know people use the term herd immunity, and it sounds awful because it sounds like animals. It's community protection, and it allows us to protect our babies under 1 year and our most vulnerable. Even the uptake of meningitis vaccine, something parents were campaigning in this House for just 2 years ago, is now only at 92.5% in England. And yet parents have that image of meningitis. They may know people, they will certainly have seen the appalling photographs of a child who is dying of meningitis and meningitis sepsis. In Scotland, we're still almost at 96%. But we face the same issues of anti-vax sentiment. We also see, for many vaccines, a drifting down of a few points every year, and we can't allow that to become critical. So we need open dialogue with parents. We mustn't push their concerns under the carpet, as that simply breeds a greater sense of conspiracy and actually leaves them open to these terrible social media campaigns. Just 2 years ago, the O'Neill report on antibiotic resistance highlighted how critical antibiotics will be going forward in fighting antibiotic resistance. Deaths at the moment are 700,000 a year from antibiotic resistance, but it's estimated it will be 10 million a year if we reach a truly post-antibiotic world. And as a surgeon, I can tell you there will be many procedures that simply cannot be carried out if we do not have the ability to protect with antibiotics. Most antibiotics, if you look at their lifespan from development to resistance, are literally less than 10 years. The longest are less than 20 years before you see resistance. And yet vaccines, we are using vaccines that are 70, 90 years old and don't have resistance. So it is critical that we tackle this anti-vaccine if we're ever going to tackle antibiotic resistance. And it's particularly for respiratory infections, because that's where the most use of antibiotics is. And there are 3 ways that the vaccines will help us with this. One is simply preventing a drug-resistant infection in the first place. It also prevents the secondary infections from viruses and other conditions, where again we're using antibiotics. And also in viruses, where antibiotics are not going to work in the first place. So it's important to realise that vaccines are absolutely central to that battle. And now we see vaccines preventing cancer. In Scotland, they ran a study looking at the effect of HPV, partly because we had such a good uptake of the HPV bivalent vaccine, and also because our cervical screening started at 20. And what that has shown is an 85% reduction in the pre-cancerous changes on the cervix. This means we are on the road to really see a dramatic fall in cervical cancer. And having watched one of my friends lose her daughter at 28 to cervical cancer just a few years ago, eliminating that disease is worth it in its own right. So we will be moving on to direct vaccines against cancer itself, and they have a huge potential to be realised as we tackle other diseases and scourges like multi-drug resistant TB. But we will only realise that potential if we can tackle the anti-vaccination campaign that is going on and re-establish real confidence among parents, not just here, but across the world.